Hello, everyone. You're very welcome. Love to see you on this. I suppose the sun's trying to come out here in the Midwest, so we'll go with that. Yeah, there's a little bit of sun there. Um, Thanks for coming and spending an hour with us today, looking at family recovery, parenting while living with mental health challenges. That's our topic for today. Um, my name is Margaret Keane, and I'm the Education, Training and Development Officer here at Mid West Aries. And for those of you who maybe aren't familiar with what we do, we are the Recovery Education Service here in the Midwest. So we are part of the mental health service in HSE Mid West, but we're also we're a hybrid service. So we're online, like we're online today with our webinars. We also have online workshops, but we're face to face across the community that we serve. So that is the Midwest, and that's Clare, Limerick, and North Tipperary. You might also be interested in some of our self-paced courses. So we have quite a few of those available on our website. That's midwestaries.ie. As we're part of the mental health service, we also deliver 2 workshops per week into both acute psychiatric units. That's in Ennis and in Ennis and Limerick. And also we're across the day service as well. So that's basically what we do. So what are we doing here today? Well, today we're going to showcase, and it's slightly different from what we normally do, but we are going to showcase a major piece of research that we were tentatively involved in way back a couple of years ago in helping with a parents focus group. But the research is called, and let me just get my my notes out here. It's Building Connections, Experiences of Parenting While Living with Mental Health Challenges, a national survey. And the final report was actually launched last April 2025. Myself and Mike went along to the launch, and the minute we heard the findings and the recommendations, and the fact that this was research that was carried out with parents and not on parents really struck a chord with us, and I suppose spoke to our ethos of co-production. So we were delighted, and we are delighted, that the team behind that research, including one of the parent advocates, will be joining us today for the panel discussion. So before we just move on, I just want to go through a little bit of housekeeping, because it is slightly different than our previous webinars. Shortly, I'm going to pass you to Professor Niamh Stack from the Department of Psychology in Mary Immaculate College, who was part of that research team. And Niamh is going to literally walk you through the background, the findings, and the recommendations of that piece of research. So that's going to be really interesting. As I said, we wanted to showcase that and share this with as many people as we possibly could. Usually, and for anybody who's been to our webinars before, you know we love audience participation. We love to hear from you, and we will be doing that from the get-go. Now, the chat function's disabled because we just want to be focused on questions and also reflections too. If you look at your screen down at the bottom, if you roll over, there should be a Q&A button there. And again, we'd encourage this from the get-go. If you just want to reflect on what's been said, or you have a question about the research, please submit it there. And I'd encourage our panelists, who are there in the background, you can't really see them at the minute, to answer them even throughout Niamh's presentation. It will be recorded, and it is being recorded, so you'll be able to share this. We'll upload it. Well, I'll upload it at some point towards the end of the week, and you'll be able to share it with anyone you feel who may benefit, and that could be parents, clinicians, staff across the service. And we also upload it as an episode to our podcast which is the Wellness Panel. I think I've got everything out of the way here, so I'm going to pass you to, and I'm going to invite Professor Niamh Stack to turn on her video and start the presentation.
Hello,
Thanks,
everyone.
Niamh.
It's so nice to be here. And our thanks, a real genuine thanks to Margaret and Mike for inviting us to talk to you. There's no point in doing research if we don't get it out into the audiences who we want to reach. So this is a really an important opportunity for us, and we're really grateful to it, not just for today's live presentation, but for the ability to offer it as a podcast and also as a video. So once those are up, we'd be really delighted if you would share them widely, because we want parents to hear about the findings of this research. Parents were so hugely a part of the research, not only in participating in it as respondents to the survey, but also in the design of it. So we've had parents on the research panel from the start, and we'll talk a little bit more about that in a little minute. But We're really glad you've taken the time to join us today, and we hope you find it useful. I promise it's not going to be too academic. The research was really, really rich, and when you go on the links later, you'll find that there is the long research report if you want to read that, but there's also an executive summary that highlights the key findings. And we only have 20 minutes today, so we're going to focus on the key findings. So I promise it will be just touching the tip of the iceberg, but hopefully it will be interesting to you. And if you want to read the longer report, there will be links to that later. Right, without further ado, I'm going to try and share the presentation. In a second, that should be coming up to you for you all as a full presentation. Great. Can one of the team just tell me when it comes live as a full presentation?
Yeah, that's good.
Great. Thank you so much, Mike. So just before we start to talk about who was part of this panel. So this was a collaboration between a lot of people. So a lot of work has gone into this, but it was the partnership that made it a meaningful project as far as we're concerned. So we were researchers from Mary Immaculate College, and that is myself, Suzanne, and Dr. Clara Hoyne. And we were in collaboration with Tusla, colleagues are here from that today, and the HSE, colleagues are on the panel from that as well, and Clarecare, colleagues are on the panel from that. And most importantly, there was, as I said, partners, parents were partners on the research panel too. So they helped drive design of the study, they helped drive how we asked the questions, what kind of questions we asked. So they were integral to it from the very start. And I think it made it a richer piece of research for that. So just kind of a little brief background to the research so that you can see kind of why were we interested in as researchers, but also, oops, let's just go back one. Let's try this way. Why we're interested in as researchers, but also kind of what was the context in which we were beginning to think about this. So what we know is that adults in Ireland have the third highest incidence of mental health illness across 36 European countries. When you think about the size of Ireland, that is really a considerable percentage of people that are experiencing mental health issues. Recent Irish research has also found that 1 in 4 parents said that they're currently experiencing poor mental health. So being a parent is challenging, but if you're a parent who's experiencing poor mental health, that can be doubly challenging. And we wanted to explore that a little bit more. 48% of parents in the previous research who experienced poor mental health said it had been moderately negative impact on their children, and more than 1 in 10 said it had a considerable negative impact on their children. And we think of possible generational effects. We want to try and stop those cycles. So what can we do to support not just the parent who's experiencing mental health challenges, but the wider family as well? And we wanted to explore some of those issues. Research also shows that having a parent with mental illness increases the lifetime risk by 41% to 77% of the child also developing a mental illness. So again, we want to think about how we, step in to provide support across the family. So what was the project like? So the project was a collaborative research project with the HSE, Tusla, Clarecare, and parents, as I said. And the West Areas were very much involved in the initial focus groups with parents to inform the survey. So what we had was a series of focus groups with parents who were experiencing mental health challenges, and to kind of identify the issues that came about for them. What were the challenges that they felt might be specific to that cohort of people? And it really drove the kind of questions that we asked. And the questionnaire would not have been what it was without those focus groups, because issues came out of those focus groups that we as researchers wouldn't have thought to ask because they weren't part of the existing literature. So to give you an example of that, we'll talk about the findings on the question around medication. So medication is a very particular aspect of experiencing mental health challenges often. And we were asking parents about how that might impact in relation to their parenting, or how their parenting might impact on their relationship to whether or not they wanted to take medication. Now, this is not an area that had been explored in the research before, and it really, really came out of the focus groups with those parents. So they were hugely important to this research. The project research board compiled the study. We decided to make it online. We discussed lots of different ways to do it, whether or not it should be a hard copy, a paper copy. But because we wanted to try and have a national reach, we decided that online was the most appropriate way. That has both limitations and benefits, that we got a wider geographical reach, but it also has limitations, and it meant that some people who are not online, because not everybody's online, didn't get to access it. So we're aware of that, and you had to have IT capabilities to complete it. So we're aware that we missed out a proportion of parents. We really felt it was important that it was anonymous, so that people would feel free to talk fully about their experiences. And we wanted it to be brief because parents are busy and parents with mental health challenges have particularly busy schedules or particular limitations on what they can give time and attention to. So we wanted it to be short but informative. So we wanted to keep it at around 10 minutes. We worked really hard as a research group to do that. Recruitment was through the funding organisations context. So HSE sent it around to all their contacts, Tusla sent it around to all their contacts, Clarecare used all of the ways that they could distribute, and Mary we used all of our social media contacts to do that as well. We used X and Insta and radio. We went on anybody's radio show that would have it. We did articles for newspapers. We were basically talking to anybody who would have us because we wanted to reach as many parents as possible to encourage them to participate within the research. We did a huge email burst to schools across the country, to libraries, to communication groups. I think we sent out in excess of 2,000 emails looking to try and reach people who are experiencing these kind of challenges. And, you know, the response was really, really good. So we got 243 respondents, for which a small scale study at this was a great reach, an absolutely great reach. And this was because, again, the collaboration, all of the research partners going out to their cohorts and coming back in. We'll talk a little bit about where the respondents came from and why these might be important as we go through the research. We did have participants from all 4 provinces across the Republic of Ireland. We had an exclusion criteria that people needed to be based in Ireland just to keep it simple and focused, and that they needed to be over 18. And so we were focusing within the Republic of Ireland. We had 1 or 2 respondents that came internationally, so it did go further reach, but we excluded them from this study, although what was interesting about the contributions from people internationally is it was very similar themes that came out and about. The participants were 89% mothers and 11% fathers. And this was really interesting to us because it's really hard to reach fathers in relation to any kind of parenting research, but particularly in this kind of research. So 11% might not seem much, but it was high for this kind of research. And the open comments from fathers were hugely valuable. So we were really delighted to get those kind of responses in as well. 88% of the respondents had English as a first language and 12% were fluent in English. For 49%, the mental health challenges were current, because we said you could participate if you're currently experiencing mental health challenges or had experienced them in the past. For 39%, it was in the past, and for 13%, it was other. And other would cover both currently and in the past, so these would be long-term issues. 44% had a formal diagnosis of mental health challenge. So they had a formal diagnosis with a medical practitioner of perhaps depression or anxiety or any other mental health challenge. 42% did not have a diagnosed disorder, but were experiencing considerable mental health challenges, which they felt impacted upon their life. 92.5% indicated anxiety. 76% indicated depression, and 35% indicated postnatal depression. However, respondents were able to indicate more than one category. So we often had people who were demonstrating or evidencing that they had more than one mental health challenging coexisting. In relation to the families, about the families, children were aged from a few months old to 31 years old within the families. We had families who participated, or parents who participated, who had families of 1 to 7 children within their houses or across different households. 94% lived in the family home with their parents, so the children, 94% in the family home with their parents. And for us, this was interesting because it again meant that there was clearly some parents that we weren't reaching as well. And we're thinking about that for future research. 76% of parents were co-parenting and 19% were parenting alone, and 5% indicated other. So other would relate to things like where there might be a parallel parenting. So both parents would have custody, but they didn't have communication between them for various reasons. So they were parallel parenting rather than co-parenting, or they may have been co-parenting in a wider family context rather than just with another parent. This question that I referred to before around the role of medication, which had come from the focus groups, was a really, really interesting question for us and brought new insight to the research in this area. So of the parents who responded who were experiencing mental health challenges, 38% said they were on medication currently. 26% said they had been on medication in the past, and 36% said they never took medication. For those who were on medication, their role as a parent was never discussed for 63% of respondents. It was discussed always for 21% of respondents and 15% sometimes. And this is really important because the open comments that we allowed within the survey gave us more insight to why this was such a big issue. So there was different reasons why it was important. The importance of medication not impacting on parenting for some parents. They were really, really concerned that they wanted to have a discussion about medication in combination with the role of the parent as a parent, because they wanted to make it clear that they didn't want medication to impact on their role of parenting. So I always made it clear that I could not be sleepy or take medication to make me sleep because I had a role as a parent. So if you go to the doctor and they're encouraging you for the benefit of your mental health to take medication, but they're not also considering your role as a parent, you don't get to have those kind of conversations about, well, I can't be sleepy because I have a toddler in the house, or how do I prioritize these, or how do I begin to manage this? Other parents talked about the importance of medication keeping them well enough to be a parent. So better health for mum equals better health to be able to be a mum. So that idea about medication being necessary to help them be a good parent. And that was a concern for a lot of the participants. There was also concerns about the impact of medication in kind of wider issues. So whether or not you become addicted and what that would mean in terms of parenting, and also medication in terms of pregnancy as well. And the need for those conversations to be wider. I don't want to take anything that could be too addictive or too heavy as a sleeping aid. So they were very clear that they wanted to have these open conversations that not just about medication and their mental health, but medication and their role as a parent. And that was really important in terms of our partners in the research who were involved in those kind of conversations and helping them get out into the medical settings for doctors, etc. In terms of parenting challenges are a part of all parenting. So we will have these kind of parenting challenges for all parents, but what we were interested in is, was there different kinds or more kinds for parents who were experiencing mental health challenges at the same time? So those who responded told us they 70% had experienced challenges. The most frequently cited challenges were fairly common across parenting, such as childhood anxiety, use of technology and screen time, sleep or bedtime, relationship with friends, homework, tantrums, mental health challenges, additional support needs, bullying, school refusal, and schoolwork. So the kinds of things that everyone experienced, but perhaps more of them and with more intensity. 66% of parents felt parenting challenges were sometimes more difficult to manage due to their mental health challenges. So it's that kind of idea that you have to have enough capacity to take care of yourself before you have capacity to take care of another person. So if you are really struggling already yourself, it's hard to have the extra capacity to care for other people. So therefore, it really is that we need to think about how to best support the whole family if parents are experiencing mental health challenges. In terms of what the kind of quotes were from parents about what this experience was like, I felt so bad because I thought as a parent I should have been the stable person, the person with the answers, the person who could control their emotions. I'll never forget the look on my daughter's face the day that I broke down. So a lot of parents talked about that sense of not wanting to feel weak for their children, wanting to be strong, wanting to be in charge, in control. And as we know, when you're experiencing mental health challenges, there are things that are really difficult to maintain. And so a lot of parents were trying so hard to stay in the strong role. I developed psychosis. Another quote from a parent was, I developed psychosis when my child was 6 weeks old. I was admitted into psychiatric hospital for 5 weeks. When I came out of hospital, I didn't feel good enough as a mom. My medication caused me to be out of it, so I couldn't be fully present for my child, which added to my disconnection with the child. And we all know the expectations we have for when we have first our child and how we think that bonding experience is going to go and how important everyone makes us feel that bonding experience is in the early stages. And if you feel that that's being challenged, that can be really, really challenging for you to come to terms with, because you so want to be a good parent, a good mother, and you want to bond with your child at that time, but it's really, really challenging. And that's why it was interesting for us to see such high levels of postnatal depression and really think about what we need to be doing that is more to support parents experiencing these very particular types of challenge at the early stages of childhood. And these are just 2 quotes, but one thing that was so important to us was the richness of qualitative data that came through. So quotes like this. Lots of other surveys have been about figures and percentages, but for us, parents took so much time to give us qualitative data to show us what their experiences behind these numbers were like. And we're really appreciative to all the parents who participated for doing that. Do parents who are experiencing mental health challenges require specific support? So we asked parents about this. And they said the answers they gave us were yes, they would like greater consideration of the impact on parenting by healthcare professionals. Great that we had fathers on board, so because they told us a small men's group would be helpful, as men don't usually talk openly about mental health. Small groups would be useful, as some men or some people find large groups daunting. So it's not as simple as kind of one solution to fix everything. So what often some people would say groups would be helpful. Some people would say, I don't find groups helpful. I need one-to-one. So we need to ensure, as we'll see in the findings as we go through them, that there are different kinds of opportunities for support for different people because they have different needs. But it was really, really good to have those voices of fathers in the research who helped us to understand that there may be very particular needs around fathers as well as around mothers. Another parent said yes, free online counselling that is flexible and available outside of working hours for parents that work full time would be useful. As we come to talk about the barriers we found later, we often found that geography or finances, the physically being able to get to face-to-face counselling or the cost of getting to face-to-face counselling could be prohibited. So having some online versions would be really, really helpful for participants or for parents experiencing these kinds of challenges. Yes, another parent said yes, help with parenting tactics, weekly check-ins from your therapist or social worker or family support worker would be really, really helpful. And that's another interesting finding for us to know. And another parent talked about GPs and services need to take parents going through a crisis seriously, as this can help the parent and their child to stay safe. So rather than being told to, pull yourself together or, you just need to get on with it, when somebody comes to you and says they're experiencing these kind of challenges, hearing them and pointing them to the right kind of supports is so, so important. What were the barriers to seeking help? Well, what were the kind of things that people talked about? The priority was around really overwhelmingly what we found was people talking about that sense of isolation, that fear of being judged, not as just as an individual, but as a parent. So we know that, there's a lot of work being done around trying to address the stigma of experiencing mental health challenges. And that has been really important work, but there is a very particular experience of that stigma when you're a parent who is experiencing mental health challenges, because you don't feel just judged as an individual, but you feel that your competency as a parent might be judged, and that you fear that, and you fear people within your family, in wider society, in teachers, etc., judging you. So that sense of isolation and that fear was really, really strong as one of the key findings of the study. But money was also an issue as the barrier to seeking support. Having the money to go seek the support, being geographically distant to where support was available, those kind of financial and practical barriers. Followed by work commitments and childcare. So often when people would say, well, I need to work because I need to be financially sustainable, but my work means that I can't get to the available support sessions. Because one of the reasons that, and I'm sure the others from the research panel will talk about this, but one of the reasons Tusla and the HSE and Clarecare were interested in that is that it's not that the supports don't exist. They're out there, they're brilliant. It's that people weren't engaging in them and they wanted to know why. And this survey tells us that some of it's about stigma, some of it about fear of judgment, and some of it's about financial barriers. So we need to work on how we can help people overcome these barriers. The links in the open comments to other parts of the survey about the value of counselling and therapy were really high, but again, people talked about the high costs involved in engaging in private therapy. What were the kind of sources of support that people did engage in? 53% of parents said yes, they knew where to access parenting supports, even if they weren't engaging in them, but 47% of parents said they did not, because they didn't even know what was out there. And that tells us we need to find different ways of communicating the kinds of support systems that are out there. The highest source of support cited was friends and extended family and some private therapy, but friends and family were the first point of call for a lot of people. And a lot of it was because they also wanted to keep what was experiencing for them private and within a close circle, again, because of the fear of stigma and shame. Then parent and toddler groups, one-to-one support from services, online forums, so school parenting support services. Schools came out as playing a really, really important role in this area for the respondents in our study. So they talked about hearing about the survey from schools. They also talked about schools being more of a kind of community centre for support as well, widening more than just being a source of academic provision for their children. So we could utilise and harness that a bit more if we were being effective. Group parenting support and parenting support helplines. We asked participants whether or not talking to other parents in similar situations would help. And 40% of parents said they'd had the opportunity to meet with other parents who were experiencing mental health issues, and 60% said that they had not. And that was important to us because some of them said we thought it would be beneficial that they had this opportunity to talk to other parents, but what the research told us is it wasn't quite that simple. Some of the people talked about it being a good thing. It made me, a parent talked about it made me feel like I wasn't alone in experiencing challenges. Another parent talked about feeling less alone, but that they can also feel judged depending on who you speak to or what other parents were in their situation. A parent talked about, I know 2 parents who would talk to me about their struggles, but I don't know if it's really helpful for me to ruminate on them. And I also feel that their situations are much easier than my own, and I feel resentment. So it's complex. How support works is complex, and we need to find the right kind of support for the person that is in need of provision. Helpful, some parents talked about parent supporting groups being helpful when we can share tips and ideas. It's unhelpful when it's all negative and there's really no hope or change, and it kind of cascades the feelings of negativity that they're having themselves. So we need to think carefully of not just providing groups, but what kind of groups and how those groups are facilitated. So a lot of interesting feedback from parents for us. We asked parents also, do your children know that you experience mental health challenges? 34% of parents reported that their children were aware of their mental health challenges. 24% said that their children maybe knew, but they hadn't explicitly discussed it. And 43% reported that their children did not know. And there was various kind of reasons why parents felt it was important that their children did know or didn't know. And there isn't any right or wrong in this, but what came through a lot was that people would appreciate, or parents would appreciate, some support in how they might talk to their children about these things. And that gave us food for thought in thinking about what kind of provision is needed too. So the kinds of things that parents were saying is that I fear they would worry if they knew that about my mental health struggles. So they were worried that their children, it would cause their children worry if they told them about their own mental health struggles. And that's why they hadn't talked to them about it. Another parent talked about the fear of frightening their children, or their children fearing that they aren't strong enough to look after them, regardless of the situation, or the fear that their children would hide their troubles or feelings for fear of upsetting them as a parent. So that kind of concern about the role of parenting, in addition to being open about their mental health challenges. What parents talked about, as I said, was that something or someone to tell me how. It's ingrained in me to hide my difficulties, so I never thought of telling my children, or would have seen this as being bad or as a failure on their part as a parent. Other parents, in contrast, talked about saying that they talked about it openly with their children because they felt that was positive. They felt that being open about their mental health issues would make their children more open about their own challenges, and it was important to have that it's okay to be not okay conversation. Others ask for maybe a picture book to help them talking to their children, or having peer support in school so they don't feel alone. Trained counsellors specifically here to help them talk to their children. Others had talked about talking to their therapist about how best to talk to their children, and having really great support in those areas. The thing that came across really most clearly to us is the need to talk and to be listened to. So in the open comments at the end, parents said things like, I heard this on the radio and I think it's an excellent idea in talking about the survey. Well done on doing this survey. It's another step in normalizing my struggle. And webinars like today and the podcast and the video are so important to us in normalizing these conversations, so parents know that they're not alone, that they're not weaker as a parent, that their competency isn't an issue. It's really about how we can best support them and their family. Parents talk about sharing really helps, and that they feel the need to talk openly about their experiences as parents with mental health issues, but fear of judgment and lack of interest from others is still holding them back. So we need to break that stereotype. Other parents talked about feeling good to know that there are researchers who care about mental health and parenting on with mental health challenges, and knowing that help is on the way. So we need to get that help and support out to parents. So we're very glad if you're listening today and that you'll be able to access some of the supports that will be talked about later. So coming to the end of the presentation, we get onto the panel. What are the recommendations that came from the research? Well, the first recommendation is around raising awareness. A variety of sources of parenting support, such as schools and GPs, should all be employed to highlight the importance of parental mental health and signpost to appropriate support services. A variety of mediums should be used: posters, social media, radio ads. Radio is really powerful in Ireland still, local radio. Lots of people listen to it, so we could use that better. Word of mouth should all be employed to advertise parenting supports and recognise parenting as an ongoing process throughout a child's life cycle, throughout a family's life cycle. Parenting education and general awareness campaigns need to address stigma at a societal level, to challenge stereotypes around mental health, medication, and help-seeking behaviours, and to address fears around judgment about parental competency and confidentiality of support services. In terms of recommendations around staff training, and this was really important to our colleagues or our collaborators on the research in the HSE and Clarecare and Tusla, staff training is important around the screening process for both parenting and mental health challenges, particularly around the importance of a sensitive, non-judgmental, think parent, think family approach, which I know Martina will talk about in a minute. Parental status and caregiving responsibilities within the family should be considered in all discussions relating to supporting the individual with their mental health and parenting, in relation to medication, side effects, and scheduling of appointments. Information about additional support for children and the wider family should also be offered when offering support for a parent with mental health challenges. And a final recommendation around engagement with parents. Parents need to be validated for seeking help, and for this to be seen as a strength as opposed to a negative. The need for a diverse range of support services to address the diverse needs of different parents, including both individual and group options. Some people need one-to-one individual and are anxious about being in group settings. Maybe perhaps after they've had the individual, they could move on to group, but some people need to work in private initially. Need to work with parents regarding communication with their children about mental health and explore their concerns, and we must respect parents' wishes in relation to this and work at the individual parent's pace. A final word before we get on to the more interesting discussion of the research panel and how they're going to implement the findings comes from a parent. The parent said to us, "I would like to say that the biggest issue for me has been trying to keep my head above water while feeling like I'm drowning, and then trying so hard to get support for myself to ensure I can be the best version of myself as a parent also." Parents want to be the best parents that they can be, and we have a wider responsibility to give them support in this parenting role if they're also experiencing mental health challenges. Thank you.
And thank you, Niamh, for that wonderful exploration of the research. I suppose what's just sitting with me are the voices of parents and the richness of those responses. And that is the value of including parents in this research. And that question around medication really sits with me. But thank you. Thanks, Niamh. So I'd just like to invite all of the panelists there to turn on their video if you can. And let me just introduce you all to this wonderful group of people here. So first off is we would call Martina wonderful because she is Martina Kilcommins, who has been really a significant driver of this research for really, this has been coming for many years, and Martina's been at the helm of this. And she is the Senior Social Work Practitioner, Adult Mental Health Services in HSE Mid West. And she's also, and I hope you don't mind me saying, Martina, a proud Midwest Areas recovery education facilitator as well. And we're delighted to have you here today, Martina. Then we go to Taryn Fitzpatrick, and thanks, Taryn, for joining us. Taryn is from Tusla, and she's the Child and Family Support Network Coordinator, Prevention Partnership and Family Support in Tusla. Thanks, Taryn, for coming today. And then we have Joanne. And Joanne Perill, she's the Family Support Service Leader in Clarecare, and anybody who lives in Clare knows how valuable and valued Clarecare as an organisation is to the people of Clare. It's an amazing organisation. Delighted to have you, Joanne. And then we have Mike. Anybody who's been to our webinars, Mike O'Neill is our fearless leader here in Midwest Areas, and great to have you here, Mike, and have your perspective on the research too. And finally, one of the parents who was involved in the research, Tracy, fingers, toes, and everything's crossed that she'll be able to join us. She's a very busy lady. She's galloping here away from work, so hopefully she will be here to join us for the latter half of the presentation of the panel discussion. And anyway, and you've met Niamh as well. So let's get started. And Martina, I'm going to come to you first. I'm going to come to you all individually to get all the voices in if I can for this particular question, because I know what's kind of sitting with me after hearing Niamh's presentation. But for you, and particularly having been involved in the research, and Mike, I want you to come in this as well. I'm going to go to Martina first and then you. Was there anything that really struck you or surprised you or unexpected about the key findings, Martina?
Now, I wouldn't say unexpected, but certainly, I suppose what has stuck with me is the findings, I suppose, around the fear, the stigma, and the isolation that people still fear. And I wasn't entirely surprised by that, but I suppose what is really as social worker within mental health, I suppose what it really, really resonates with me is the need for us to do more, and the need for us really, and I think Niamh highlighted it earlier, yes, we know that there is stigma around mental health, but even the stigma around being a parent is, you know, and parent with mental health, when there's so much emphasis on being that perfect parent, is huge. So that's the piece that's with me. It's that fear, stigma, and isolation that people feel. And I suppose what I'm left with is how can I and how can we as a service create a space that reduces that fear, that gives permission for people not to feel, you know, we hear these campaigns, it's okay not to feel okay. But if you don't meet the person with that non-judgmental stance, it's so difficult. So I suppose that's the piece. It's how I can bring that. That's not a surprise, but it's left with me, I suppose, still, that we've work to do on that, really. Yeah. There's loads of other things like the medication. It's just really, lots of things have come up, kind of says we've more to do in opening up the conversation and seeing people as a parent. Yeah. So yeah.
Absolutely, Martina. And stigma is alive and well. We know that from our workshops. And Mike, just coming to you on that, obviously coming relatively new to the research. I know we've had a few weeks to look at it, but what sits with you? What was a surprise maybe for you on the research findings?
I suppose not a surprise, but delighted to see. And I know when Niamh did the presentation at the launch, it was the percentage of men who participated and the quality of their engagement was highlighted at that launch. So that was a standout for me. But also in the presentation, it was to see it's easy to make the assumption when we think about parenting, we're looking at babies and toddlers. How can we manage this? And, you know, to see somebody there, you know, who is a parent of a 31-year-old, you know, so you don't stop being a parent. And I think those are kind of I suppose it's nice to blow the doors off the assumptions we all make, or where we could easily slip into this is what it looks like without actually inquiring or asking. So I think the research highlights those. Those were kind of, just a couple of nuggets, but I think that all of it is rich, you know, so there's something in this for everybody, you know, no matter what your role, what your work is, or even just as a parent looking in. Thanks, Mark.
And I think you're right, Mike, that was a standout for me as well. And I would actually, parents who are listening to this and clinicians as well, or people working the service, obviously read the summary, but if you read the full report, you hear those voices and they might connect with you and might sit with you. Taryn, I'm going to come to you next in terms of the findings. Anything you want to highlight that stood out for you?
Yeah, I think as Mike highlighted there, Margaret, you know, I think there's something in this report for everybody, you know, to learn from, to experience, and we're so thankful for all of the parents for sharing all of the experiences. I think a statistic that really struck for me and was that experience of a parent not having their role as a parent discussed in discussions around their medication plan. And I suppose it just really highlights the value of professionals and parents working together in a true partnership, hearing the voices of parents around what is their experience of that and how can we support that better. Yeah.
Fantastic, Taryn. And that's it. And I suppose that really chimes with our spirit of co-production, you know, it does make a difference. Joanne, I'll come to you next. So for you, in terms of the findings, what stood out?
Thanks, Margaret. And I suppose we're very grateful to Midwest Dairies for providing us with this opportunity to present, I suppose, this very important piece of research. But I suppose for me, it was kind of the statistic around that, like 47% of parents didn't know where to ask it or where to access parenting supports. And, you know, I think for us as a service, where I suppose one of our main focuses is around the provision of parenting supports, that's something that we need to heed. And, you know, while a lot is happening in Clare around the provision of parenting support, and I suppose most specifically and recently in relation to the launch and the development of the Clare parenting website. But I think the finding reminds us really and encourages that we need to continue doing more and continue building on what's happening already. And also, I suppose the bit around, you know, I suppose the learning that schools are an effective way to disseminate information was also very helpful in terms of, I suppose, trying to address that statistic in some way. So that's been very useful, I suppose, to learn that through the research.
And that stood out for me as well, Joanne, the role of schools. That really was something. And I'm delighted. I think Tracy's just about to join us, which is absolutely perfect timing, Tracy. If you want to turn on your video there. Hi, Tracy, how are you?
Hi, Margaret. Sorry, I think I joined with the wrong link. I joined with the other link.
Tracy, we all do that. So it's no worries at all. And I just want to introduce Tracy to the attendees. Tracy, who's a parent who was heavily involved in the research group, and again, bringing that really important voice of parents right from the get-go, right from the focus group up. Tracy, I suppose I just want to come to you, and sorry for landing you. You've just landed in. But I've just asked the other panelists, what surprised you? Was there something that stood out in the research that maybe might have surprised you or stays with you? Is there something there that you'd like to share?
There's a lot. There's a lot I want to share. To be honest, at first I thought like there are few people that are going through mental health that they don't want to discuss, but listening to other parents, it makes me feel like I'm not alone. It makes me feel like other people that have heard their stories, that they are fearful of being judged. Like we are a lot of parents are having that feeling, and I'm so thankful that this is happening, and it's going to really going to help us, especially those of us that we feel like, oh, I don't want to talk about it. A lot of people are smiling and pretending everything is okay, but truly they are not okay.
And Tracy, that's so important. And again, because we run recovery education workshops with a lot of parents, probably hundreds over the years, that piece of being alone, I think you're absolutely on the money there. Just by having this research done in itself is something that, you know, that realization, as I said, go to the full research piece and you can hear those parent voices. It's just so rich and so meaningful. Thanks, Tracy. I'm just going to go on to another question. Now, we do have questions coming in through Q&A, and thank you so much for putting those in. I have a list of questions I've got to get through here. You can see we're tight on time. So if anybody is in a position to answer those questions by typing it in, I would really appreciate that. So I'm going to come, Taryn, I'm going to come to you with the next question. And we've already kind of touched on it, and you've touched it in terms of service provision. So based on the research findings and maybe the recommendations too, what do you think, how does service provision need to change to better support those who are parenting with a mental health challenge and families in general?
Yeah, I think it's just really important, Margaret, for all, all services, across all services, to really hear the voices of parents, to move at the pace of parents, and to sometimes actively seek the voice. And, particularly when things are sometimes challenging, when a parent might be finding it difficult to access supports, or if supports aren't working in the way that the parent would like. But talking with the parent, hearing how the parent is experiencing that, and looking at what can be done to support a parent to make that work better, and what's helpful right now at that moment.
That's brilliant, Taryn. Would anyone like to come in on that idea of service provision and changes that need to be made? Mike, thanks.
I'll just jump in there, and I suppose you lead by example. When we talk about culture within the HSE, and kind of it gets a bad rep, but when you look at what's happening here, there's people here from Clarecare, Mary Immaculate, at the college, HSE, Tusla. That's the way you do it, and I think co-production at the heart of everything we do, and I think that's what we saw, and that's where what makes the research so rich is bringing in, you know, the voices of the people, you know, who are using the service. So like, that's the only way you can respond. It's like, you know, we used to have a line we'd have here previous is what happens when you ask people, you know, so you have to be brave. You have to, you know, do something, and take a chance, but at least try, you know, and join the dots and be collective, you know, and if you don't get it right first time, keep going, you know, and that's the piece as well, kind of. But I think this is a good example of, you know, how it's not hard to join the dots for people to work together collectively. It's as simple as that, you know.
Absolutely, Mike, and you're absolutely right. This is a great example of that. Niamh, I know you want to come in on this point.
Well, Mike stole some of my thunder. I really wanted to say, if you want to know how to improve service provision, ask the people that you're providing the service for. But the other thing I want to say is that for me, improving service provision, you know, Martina and Taryn and Joanne, in terms of thinking about what surprised them, there wasn't anything in it that they didn't already know, but this gives them evidence. So it's those partnerships, these collaborative research partnerships that are so important, that the parents were able to tell us how to do the research, what to ask. The practitioners are able to implement it, and we'll be able to evidence it. So for me, it's so important that we have these kind of collaborative research, because it helps give us direction, but it also helps service providers evidence rather than anecdote, so that we can push things forward. And I know Taryn did a great talk yesterday to Tusla and to all of her organizations. So like the feed into practice is huge. And I know Martina's talked to doctors, so it's going places.
Brilliant, Niamh. And Martina, I know you want to come in there, so I'm just going to pass to you.
Yeah, I mean, and I think it's echoing. I suppose what was been struck for me, even when Taryn started talking, it's together with the person, with the parent. You know, there's nothing like, you know, we can have all sorts of ideas, but we need to do it with the parent. So it's not one service. And I know there was something in the Q&A there. It's about services working together with the parent, you know, that we do it together. And if they have fears about one suggestion, we need to understand that and work at that. A bit like the research, what the research has been doing. There was lots of over and back, even during our whole process of getting to what we got to. So I think it's about that. It's not one way, and it's about working together. Together, I think, is key.
Yeah, I think that is the word.
You know, that it's not doing it, you know, doing it on them, it's with them, you know, and I think that's what, you know, and respectfully, yeah.
And actually, Tracy and Joanne, I'm going to come to you in a moment, but just want to follow on dig a little bit deeper. Tracy, I'm just going to come to you on that, because obviously as a parent heavily involved in this research, so we're talking about service provision. What was it like being included in this research? Not just included, but being really part of the process, not just, you know, being asked questions. What was it like for you?
Oh, it was amazing. At first, I was kind of thinking, I wasn't too sure, but looking back, I don't ever regret being on the panelists, being on the like the whole research team, because it really makes me feel like they really do understand. Like Niamh said, like if you want to find a way to help, like the person you are going to help, involve that person. And that's exactly what they did. And we, on behalf of the parents, we are so thankful. Like it would be a lot different for me. I wouldn't even be serious like doing the survey if I wasn't involved, because I'm like, oh yeah, that's one of those things. Because I do like kind of fill all those random surveys. But this one, it was really touching my heart. I was like, this is part of me. This like I'm really like part of it, and it's really helps, because I believe that's what the other parents that were on it to feel. I can't speak for them, but I definitely think that's exactly how they are feeling, because it looks like we are being heard. Finally, someone is listening. Someone is willing to help, and the only way they can help is really if they understand where we are coming from. So I am really hopeful this is going to really be like a life changer. It's going to be amazing for all parents.
And thanks, Tracy, for sharing that. And absolutely, it must make the team feel good to hear that. That's where the richness comes from, having those voices there, but doing it in an equal and reciprocal way. It's so powerful. Thanks, Tracy. Joanne, just again in that service provision piece, and sorry, I just want to just dig a little bit deeper there in terms of the parental experience.
Of course, Margaret. I suppose just following on from what Tracy was saying there, like I think it's, you know, how do we kind of show parents that we understand the connections between you know, parental mental health and and parenting, you know, whether it's in our advertising or whether it's in our kind of everyday conversations with them. You know, like, how do we kind of create the spaces really to, I suppose, encourage those conversations and see them, I suppose, as a person in their own right, you know, and not just as a parent. So like whether that's in the kind of, you know, routinely asking, like, you know, how are you, and building from there. But I do think there is something in us kind of taking a lead in showing parents that, look, we understand that these two things are interlinked, and we're okay to talk about it, and it's okay to talk about it, but that we kind of need to take the lead in that at times.
Absolutely. And I think it is that trust building piece, isn't it? And as I think, Martina, you said, that non-judgmental way, having a non-judgmental conversation. Yeah, we've looked a tiny bit at service provision, and that is kind of difficult to change, but an organizational change, as we know, takes a lot and a long time. So I'd really like to we're kind of nearly coming towards the end, but I'd really like to give people, whether it's parents or clinicians or staff listening, some idea of one achievable thing they could do right now. Because I honestly believe, you know, when you've got more information, was it Maya Angelou said, you know, when you know better, you do better. So what one achievable thing do you think individual clinicians and people working across the entire healthcare service, so it could be primary care, you know, it's not just mental health. Remember, parents come through the entire primary and secondary care system. And what could they do right now to support parents in their mental health recovery and family recovery in general when it comes to mental health? Who'd like to come in on that? So if we can just bring it down to the one achievable thing, we've kind of already touched on it, Joanne, in terms of having those conversations. That's what spoke to me. Um, who'd like to come
Yeah,
in?
I think
Mike.
that in simplest terms, like for any clinician in any engagement, you know, first of all, like, I suppose you have to build a relationship with the person. But I think when you do that with someone who's, you know, using, you know, one of the services that we're speaking about, it's like for any clinician or any, you know, worker who is engaging with a family member, is ask them, you know, how is your parenting? Is, you know, is what is the reason you're here? You know, are there challenges you're facing impacting? You know, and just ask, you know, because I think, as Tracy correctly said and came out in the research, it's been heard. Yeah, you know, and that in itself can have, just even asking that question, that someone is actually listening, somebody cares, I'm being valued as a human being here, and it's acknowledged that this journey for me is quite difficult. And so, without even offering solutions, that process in itself is hugely important. You know, I think, yeah, there's a therapeutic value for somebody using a service when they feel heard. I think you're halfway there to any solution at that stage. Yeah.
And again, it chimes in with having a recovery focused approach, seeing the person as a whole human being with, you know, different roles, not just as a patient. Again, anybody else with that one small thing? Joanne, sorry, I just saw your
You're
hand
okay. You're okay. Well,
raised.
I just put it up, to be fair. I think it's spot on from Mike said. I think we have an Irish way of saying, like, how are you, when we mean hello. But I think when we intentionally and ask that in a sincere way, that we are interested in how people are and in hearing how people are. And if we start conversations even with that question, if we start conversations with parents around that and just give them a space, I suppose, to say how they are, and then I suppose to move into how they are in their parenting. So I just think we need to be just more mindful of engaging parents with where they're at and what's happening for them, in order to help them, I suppose, be better placed to look at their children's needs.
And that's perfect. And again, that's one small thing you can do straight away. Anybody who's engaging with parents, you know, Martina, I know you want to come in on this. I'm going to come to you, and then Taryn, I'm going to come to you. So Martina,
So
one small achievable
one
thing.
small thing, I was thinking for staff. I was thinking, you know, for people who maybe staff-wise listening here today, maybe just stop and think, pause, and think of the next person you're going to meet. Or if you haven't a person to meet today, maybe the person you met last. And did you ask them? Did you hear their story? Did you think of where they're coming from? Are they a parent? And if they are, did you chat about that? Did you just meet them where they were at? And I think that's maybe something that we can all do and use our support structures to reflect on it. There's days I do this good and there's days I'm not so good, you know, and I think even being in the service a long time, you can get a bit desensitized. You know, we hear these stories, but then sometimes this is a person who's the first time they're coming through our door, maybe, or maybe it's the 5th time and it isn't easy. So it's just about meeting the person as a human, and as a staff, thinking about that and reflecting on it, and just I think that could help. Yeah,
Brilliant,
yeah.
Brilliant. No, I think Martina, it's brilliant. And it's all about being mindful, isn't it? Really, being really in the moment. Taryn, and then Tracy, I'll come to you next after Taryn. Thank you.
Thanks, Margaret. Yeah, I think just really, as we've all said, really truly hearing the voices of parents, but also looking at and making sure that as services that we're flexible, you know, that there's a wide range of supports that we can offer, whether it's one-to-one support that might work well for somebody, you know, a group support coming in for, you know, supportive conversations, therapeutic, you know, counseling supports, or, you know, just calling in for that cup of tea and that supportive chat as well. So it's really about hearing the parent, what's helpful at this time.
And again, really something very, very simple. And I love that because you're giving people takeaways. Tracy, for you, what's the one small thing that would make a difference right now?
So as Martina said during the lunch, she said one thing that really stuck with me, and I came home and cried. Well, it was a happy cry because it really touched my heart and it stuck with me, and I can never forget that statement. She said, "Think parent, think family." So I would really wish a small change that I would want is when parents are assessing services to think about not just me but my family. So then if I come and I need support, not just being prescribed medication and then off I go. What is the medication going to do to me? What are the side effects? Am I able to take the medication and at the same time be a parent? That's the small change I want.
And Tracy, I think actually that is probably the most perfect point to actually pause the discussion for the moment and let that sit. Because that's a really important one. Think parent, think family. I just love it. And I know Martina did say that at the time, but you've just really embellished that and give very practical view around it. So thanks, Tracy. That is really important. We're coming towards the end, and I know we could stay here for hours. There are some Q&As there, in questions there in the Q&A, and thank you so much for sharing. If panelists could have a look at that now, I'd really appreciate it. Anything we don't get to, we will do our best to have a discussion about it afterwards and try and send out those Q&As either in the notes section of the podcast or in the YouTube or by email. So please bear with us. You can imagine it's been quite a quick one today. I'm going to just share my screen now and just do a little bit of signposting. Okay, and Mike has been very good. He's put in our feedback form. If you have time, look, we live or die. We always want to know how we're doing and how better we can do. So please complete that feedback if you have time. It's only a couple of minutes. So I've already mentioned this, but if you want some extra support in terms of recovery education workshops, it is all about empowerment and it's all about lived experience. That's what we bring to the health service, mental health service in the Midwest. In June, we're looking at anxiety, depression and self-care, building my resilience. But we're also, as I said, right across the 3 counties we serve. I think we're in Kilkee, Kilrush, gosh, we're in the Hunt Museum, we're in Limerick City Library over June. So do check it out. All of our events, apart from Limerick City Library, is actually available on midwestareas.ie.
Margaret, that's not sharing.
Oh, gosh. Okay, we'll try it again.
Yeah.
Apologies for that, lads. I can see it on my side. Is it sharing with you?
Yep.
Yeah, finally. Yeah. There we go. There's the June timetable. I'll be quick now. And Also, as I mentioned, self-paced courses, important for families, understanding acute mental health service for families, carers and supporters. It's about a 2.5-hour self-paced course where if you've got a family member either in Ennis or in 5B, you can literally go through those doors and meet the people behind it and see what it's about and your role in their recovery. Also, another one, we've got perinatal, a rake of perinatal self-care resources that can be found at perinatalselfcare.ie or on our website, including an audiobook on perinatal self-care. Really important, and I would just stress, please do have a look at this research. It's really, really important. Share it with whoever you or whomever you feel may benefit from it. And again, anybody who's come today or has registered will get these slides, so you'll get those links. And this is really important. And I know Taryn put in the Clare parenting website as well, which is fantastic, a rake of resources there. And I'm so proud living in Ennis that this has come from Clare. I know it's a nationwide survey, but really proud of that. So the parent support line offering a listening ear, parenting tips and guidance and signposting to relevant services. We saw that was really important. But what gets people to pick up that phone? And we need to work on that to make sure that when the services are there, that people A, know they're there, but B, feel comfortable in accessing them. There's Mid West areas you can come and visit, and then that's just our details. Do check out, if you like podcasts, I think I'm slightly addicted to them at this stage. We have, this will be an episode on the wellness panel as well. I'm just going to pass you to say your goodbyes. We're just literally hit 3 o'clock. I feel we've literally only scraped the surface of this, but at least it's a start. So I'm going to just say as my screen goes, Niamh, if you want to say your goodbye, and I don't know, just a thought for the day that's sitting with you right now that you want to share.
Fathers, it's okay, because listen, there are particular issues, but women are better at talking to other women. But fathers, talk to people. And thanks to all the parents who participated.
Fantastic. Thanks, Niamh. Mike, just because you're next on my screen, do you want to say your goodbye and a quick thought?
Yeah, and I'm a man of many lines, and one of Ms. And what I love about today is, well, you know, everything starts with a conversation. And I think, that's where we're at now, and hopefully we'll explore and see where the road takes us. Yeah.
Great.
Thanks,
Great, Martin. Great, Mike. Let's continue this conversation. Martina.
Yeah. Thanks, everybody, and thanks, Mid West, for the opportunity. I suppose my thought is reaching out, getting help is a strength. So please do reach out.
Absolutely.
And we'll meet you and direct you and support you. Yeah.
That's brilliant, Martina. And our vulnerabilities is our strengths if we recognise them. Taryn, your goodbyes, please.
Yeah, thanks very much, Margaret, and thanks for having us today. I think, you know, what really, I suppose the takeaway message is, you know, together is key, you know, parents, professionals, together we can support. Yeah.
Fantastic. And that, together. Yeah. I love that. Joanne, do you want to say your goodbye?
Yeah, thanks, Margaret, and I suppose, thanks to Mid West Areas again for the opportunity really to present this research. So, like, I think for me it's kind of like, you know, like even throughout this process, like the value of including parents all along the way. I suppose we always knew it, you know, to some extent, but actually kind of to have experienced it throughout this process from beginning, middle, and end, and just, well, I suppose what that has contributed to the research and what we've done and what they have helped us do really, and just, you know, to continue that in everything we do really going forward.
Brilliant, Joanne. And I think what you've done is you've actually, it's beyond proof of concept now. You've shown it works, and it gives a richness that you can't get if you don't include those people who you're trying to serve. And finally, and I think it's very appropriate that we leave our goodbye with Tracy. And I just want to say to Tracy, thank you so much, because I know you busted a gut to get here, and you're a busy woman and you still did it. And that shows the level of commitment that you've had to this project. So thank you for that. So do you want to say goodbye and maybe a closing thought?
Thank you, Margaret, for having me. I really do appreciate it, and I'm overwhelmed that if I thought about yesterday, I wouldn't think I'll be part of this. So thank you so much. I truly appreciate it. And to all parents that are on listening, I just want to say there is hope. So reach out and there is help out there. Thank you.
And thanks, Tracy, and it's been a privilege to have you. It's been a privilege to have you all. You're just absolutely amazing. Keep fighting the good fight and making this happen, and just go to next steps. And I know we're just at the beginning of this, and I'm truly, truly excited about what happens next. I finally want to just thank all our participants. Thank you for sticking with us. I know we've gone a couple of minutes over, but I think it was worth it, and I hope you do too. And we'll be back in July when we're starting a Chime series on webinar. We're going to be looking at connection and what that might look like. So I hope you can join us then. And whatever you do, be kind to yourself today and be kind to others as well. And I hope to see you again soon. Take care.